Okay, so today we're going deep into a topic that's pretty crucial, but honestly, a little scary too.
Oh, yeah.
Yeah, what happens when our bodies just stop, well, communicating properly, When
The
those signals get crossed, messed up, when things go wrong with our nerves?
nervous system, yeah, it's a delicate system.
Exactly. So we're talking like spinal cord injuries, nerve
Uh,
disorders, all those things that can really impact how we live.
Absolutely, and it's something we often just take for granted.
Yeah,
We move, we feel, we react, and we don't even think about it. But then when something disrupts that, well, everything
big
changes.
time. And it's scary to think about, but spinal cord injuries, from accidents, falls, things like that, they're more common than we'd like to think.
And they tend to happen to, well, it's usually young men.
Oh, really?
Yeah, it's often young adult men.
Yeah.
And car accidents, those are a leading cause.
Wow. So if one of those injuries does happen, what happens?
Well, it's all about speed. Nurses, doctors, they're trained to assess the situation so fast, they look for any signs of, well, damage to the nerves.
So, like, what kinds of signs are we talking about?
Like, can they feel their limbs?
Yeah.
Any weakness? Paralysis? What about their reflexes? Are those changed? Can they breathe? Okay, those are some of the first things they check.
It's so much more than just, can you move your arm?
Oh, yeah, for sure. Way more. It really depends on where the injury is on the spinal cord, different symptoms, depending on the location.
Oh, that makes sense.
Yeah, like an injury high up on the spine, say above C4.
Okay.
That could even impact someone's ability to breathe.
Oh, wow. That is serious.
Yeah, that's why you need medical help right away, like immediately.
So the higher the injury on the spine,
Yeah, the bigger the impact,
Yeah.
generally speaking, yeah.
wow. Okay, that's really good to know. So let's say someone has a spinal cord injury, it happens. What are the first things that nurses and doctors do?
First things first, stabilize the patient. Make sure their airway is open, breathing's okay, blood's circulating.
Right, right.
And of course, immobilize that spine. It's so important to prevent more damage.
So those are the immediate things.
Mm-hmm.
But what about, like, long-term care? What are the goals there?
Well, long term, you want to help that person be as independent as possible, have the best quality of life they can. It takes a whole team, but nurses, they're really at the center of it all.
Oh, for sure.
Preventing complications, bed sores, blood clots, things like that, helping patients learn new skills so they can take care of themselves.
That's amazing, learning to live, to thrive,
Yeah,
even after something like this.
it is, but it's not easy.
Of course not. It's a journey.
Yeah. And, sometimes there are unexpected things that pop up, like our source material, it mentions something called autonomic hyperreflexia.
Autonomic hyperreflexia. No, I don't think I've heard of that one.
So, okay, imagine this. Someone, they have a spinal cord injury,
Yeah.
and suddenly they have this pounding headache.
Wow.
They're sweating like crazy, their blood pressure goes through the roof.
Okay, that sounds bad.
And the trigger, something simple, a full bladder.
No way.
Yeah, or even like a wrinkle in their clothing.
A wrinkle. You're kidding.
Yup.
That is
Ah.
that is wild. Something so small can cause such a huge reaction.
Yep. And that's exactly why you need to monitor patients constantly
Hmm.
and react fast if something happens, especially after spinal shock resolves.
Right.
It just shows how, well, how connected everything is, the nervous system and, seemingly unrelated things. And we can't forget the psychological impact of a spinal cord injury.
Of course, yeah.
Rehab's not just about the body, it's about the mind too. Helping someone cope with all the changes. It's a lot to deal with.
It really is.
Yeah.
You're right. Their whole world has been turned upside down.
Yeah, it has. And we've been focusing on spinal cord injuries, but there are so many other things that can go wrong with the nerves locally, in specific areas.
No, right.
Our source material, it covers a bunch of different conditions.
Like what?
Spinal cord tumors, trigeminal neuralgia. Have you heard of that one?
I don't think so.
Then Bell's palsy, Guillain-Barré syndrome, even tetanus and botulism. They all have to do with the nervous system, but they're all so different.
So many different ways things can go wrong. It really shows how important the nervous system is.
Absolutely.
So, where do we even start? What should we tackle first?
Let's start with something pretty scary sounding.
Okay, I'm intrigued.
Trigeminal neuralgia. Sudden excruciating pain right in the face.
Ooh, that does sound scary. What is that? What are the signs? What causes that kind of pain? I have so many questions.
So imagine you're just brushing your teeth.
Right.
Or, you feel a light breeze on your face.
Yeah.
And bam! It's like a lightning bolt of pain right in your cheek, your jaw.
Oh, wow.
That's trigeminal neuralgia. It's caused by, like, irritation, compression of the trigeminal nerve.
The trigeminal nerve.
Yeah, that's the one that controls all the feeling in your face.
So something as normal as brushing your teeth can set it off. That's crazy. What can you even do for that?
Well, that's where the doctors come in.
Of course.
They can prescribe medications, things like anticonvulsants.
Anticonvulsants. Aren't those for, like, seizures?
Yeah. But they can also help calm down those overactive nerves in the face.
Oh, interesting.
And, in some cases, if it's really bad, they might do procedures, like nerve blocks, or even surgery.
So many options.
Yeah, it really depends on the person, how bad the pain is, that kind of thing.
Makes sense.
Yeah.
So trigeminal neuralgia, that's one condition that affects the face.
Mhm.
But there are others, right?
Right. Let's talk about one that's, well, totally different.
Okay, hit me.
Bell's palsy.
Bell's palsy. Now, didn't George Clooney have that?
He did. He talked about it pretty openly, actually.
Yeah, I think I remember that.
It's a condition that it can be pretty scary when it happens. It causes weakness, even paralysis on one side of the face.
Yeah.
You can't control your expressions.
So it's not pain, it's more about function, losing function.
Exactly.
What causes that paralysis?
Well, it's often linked to inflammation in the facial nerve.
The facial nerve.
Yep, the one that controls the muscles you use to smile, frown, blink.
Oh, wow.
All those things. Yeah, it's like those muscles, they don't respond the way they should.
I bet that's really unsettling. To wake up and, like, not be able to smile normally or, close your eye all the way. What are the signs? Like, how do you know if you might be getting Bell's palsy?
It usually happens pretty suddenly.
Oh, wow.
Yeah, one side of your face, it might feel stiff or, droopy.
Mm-hmm.
And maybe you try to smile and one corner of your mouth just doesn't move, or you try to close your eyes and one just won't close all the way.
Oh, that's strange. So it's pretty noticeable visually.
Yeah.
What's the treatment for Bell's palsy? Can you fix it?
The good news is it's usually temporary.
Oh, okay.
It often goes away on its own after a few weeks, maybe a few months. Yeah, but doctors usually prescribe something called corticosteroids.
Corticosteroids.
Yeah, to help it heal faster, reduce inflammation, things like that. And, if they think it might be a virus, they might give antivirals too.
So a little bit of a waiting game, but you can do some things to help.
Right.
Speaking of waiting games, Guillain-Barré syndrome, that's a pretty scary one.
Yeah.
Paralysis, right?
Yeah.
And it can even affect your breathing.
It is serious.
This doesn't sound temporary.
No, Guillain-Barré is definitely more serious. It's an autoimmune disorder.
Autoimmune.
Yeah, so your body, it attacks its own nerves,
Whoa.
the peripheral nerves. And yeah, like you said, it can progress pretty fast.
Uh-huh.
Starts with weakness in the legs, then moves up.
Oh, wow. That's really scary. So your body's basically attacking itself. How do you even treat that?
Well, the goal is to kind of calm down the immune system,
Okay.
stop it from doing more damage. 2 treatments are often used. Plasmapheresis.
Plasmapheresis.
Yeah. And intravenous immunoglobulin, or IV.
Okay, so those are the names. Break those down for me. How do those work?
Okay, so plasmapheresis, it's kind of like a filter for your blood. It takes out those harmful antibodies that are attacking the nerves. And IVD, that's like giving your immune system a boost of healthy antibodies, like helping it fight the bad guys.
So both treatments are basically trying to, like, rebalance the immune system.
Exactly.
That's incredible, the things they can do these days. What about, like, supportive care while someone's recovering? I mean, if they can't breathe on their own, they're going to need some help, right?
You're absolutely right. Supportive care is super important, especially in that acute phase.
Right.
So that might include things like a ventilator to help with breathing,
Yeah.
Monitoring vital signs, making sure everything's okay, and even physical therapy.
Oh, yeah, to keep the muscles strong.
Exactly, and prevent complications from, not being able to move around much.
Makes sense. So it's like a two-pronged approach. You're tackling the immune system problem and also taking care of the immediate needs.
Right.
Now, earlier you mentioned CIDP, which I think stands for chronic inflammatory demyelinating polyneuropathy.
You got it.
Okay, good. And you said it was kind of similar to Guillain-Barré, but slower? Does that also involve the immune system going, haywire?
It does.
Okay.
CIDP, it's like Guillain-Barré's cousin.
Okay.
Still autoimmune, still affects the peripheral nerves, but it's much slower. Instead of like, bam, it's more like a gradual thing over weeks, months even.
Oh, wow.
And because it's chronic, the focus is more on managing it long term.
So instead of trying to stop it all at once, you're trying to, like, slow it down.
Exactly.
So how do you treat CIDP?
Well, corticosteroids, those are often the first thing they try.
Oh, right.
Helps with the inflammation,
Yeah.
calms down that immune system attack.
Yeah.
And sometimes they might add other immunosuppressant medications.
So you're trying to find that balance.
Yeah, where the immune system is calm enough to protect the nerves, but still strong enough to fight off other infections.
Right, right. That makes sense. And what about like physical therapy and all that?
Oh, that's important too.
Yeah.
Helps people stay strong, flexible, keep doing the things they need to do in their everyday lives.
That's really important. Even with a chronic condition, you can still find ways to live well.
Absolutely.
Now, before we wrap up this part, I want to go back to tetanus and botulism. Those are the two you said can be prevented, right?
Yeah, big ones. They can be really, really dangerous, even deadly.
Hmm.
But thankfully, we have vaccines.
Vaccines. It's amazing how effective those are.
Right.
So remind us again, what causes tetanus and botulism? Why are they so bad?
Okay, so they're both caused by toxins.
Toxins.
Yeah, and these toxins, they mess with your nervous system big time. Tetanus, everyone thinks of rusty nails.
Yeah, rusty nails.
It's actually caused by bacteria, and those bacteria, they release a toxin. And that toxin causes these really, really bad muscle spasms.
Like lockjaw.
Exactly. That's the classic tetanus sign.
So it's not the rust itself, it's the bacteria that could be on it. What about botulism? Is that bacteria too?
Botulism is a little different. It's caused by a toxin, yeah. But this toxin comes from a bacteria called, well, it has a long name, but it's Clostridium botulinum.
Okay.
And it usually comes from food that's gone bad.
Oh, yeah.
Yeah, not good. And this toxin, what it does is block nerve signals.
Blocks them.
Yep. And that leads to muscle paralysis.
With paralysis again.
Yeah. And if it gets really bad, it can even affect the muscles you need to breathe. That's why it can be fatal.
Okay, now I'm really glad we have vaccines.
Me too. And it's important to keep those boosters up to date, especially if you get cuts and scrapes a lot or work outside.
Good advice. So we've learned about a lot of different nerve disorders in this part. But there's still more to come, right?
There is.
All right, well, stay tuned for the final part of our deep dive. We'll wrap up all this nervous system talk.
Yeah.
Welcome back to our deep dive.
It's crazy how much we've already talked about, all these things with the nervous system.
I know, right? It really makes you think.
It does, from like the big stuff, the spinal cord injuries, to the more unusual things like that trigeminal neuralgia.
Yeah, that facial pain.
It's clear that when the nervous system's involved, things can get pretty serious.
No kidding. And the thing that gets me is how connected everything is.
Oh, yeah.
Yeah, we've been talking about how, something so small, a full bladder, even a wrinkle in some clothing,
Right.
that can cause like a life or death situation in someone with a spinal cord injury.
It's wild.
And then you have the immune system, it's supposed to be protecting us, but sometimes it attacks our own bodies.
Like with Guillain-Barré.
Exactly, and
Ugh.
CIDP.
Yeah.
So, yeah, it's a delicate balance for sure.
No doubt about it. It really makes you appreciate just how much we rely on all those nerves working properly. Every single day.
Yeah. So as we wrap up this deep dive, what are the key things you want people to take away from all this?
Well, if I had to pick one thing, it would be this. If you notice anything weird, anything off, don't wait.
Weird, off, like what kinds of things?
Sudden weakness, numbness, feeling uncoordinated, or any kind of severe pain.
Okay.
And especially if those things are happening along with changes in your vision, your speech.
Yeah, that doesn't sound good.
Get medical help right away. Don't mess around with that stuff.
Always better to be safe than sorry.
Right.
Hmm.
And we've been focusing on the medical side of things, but it's important to remember the human side, too.
Oh, absolutely.
These conditions, they affect everything. Relationships, work, hobbies, how you see yourself.
Your whole life.
Yeah. So healthcare, it's not just about treating the symptoms, the physical stuff.
Right.
It's about support, empathy, understanding what people are going through.
Supporting them, their families, everyone involved.
Exactly. It's about listening to people, helping them in practical ways, maybe connecting them with support groups. Those things can make a real difference.
Yeah. So it's about seeing the person, not just the diagnosis.
Exactly.
So as we leave everyone with all this food for thought, what's the one thing you want them to really think about?
Just think about all the amazing things your nervous system does for you. All the time. Every second of every day. You can move, you can feel, you can think, you can experience everything because of it. We've talked about what happens when things go wrong, but let's not forget to be grateful for a healthy nervous system.
That's a great point.
Take care of it, protect it, and, just marvel at how incredible it is.
That's a perfect way to end this deep dive. So on that note, we'll leave you to ponder all this. Until next time, remember, knowledge is power, especially when it comes to your health. And that includes the awesome, sometimes baffling, world of the nervous system.